If it is not on, then we have to restart.
Okay.
Yeah. Sorry, but yeah, it wasn't on.
It wasn't?
Yeah, so we need to start from the beginning. We apologize for that.
If you can just lift up your right hand and repeat after me, please. I swear
Swear
by Almighty God
by Almighty God
that the evidence
I
shall give
to this commission
shall be the truth,
the whole truth,
and nothing but the truth.
So help me God.
Thank you, Dr.
Thank you.
Okay, I think this is the most important part, the oath. The rules, you already know the rules, but I've reminded you. You confirm that I've reminded you some of the rules. I think we will just go straight to taking your evidence now. Over to you, Commissioner Fidot.
Good morning, Dr. Mills. So you are the medical doctor attached to the prison services of Seychelles?
Yes, sir.
And for how long have you been working?
4 years now.
4 years.
4 years.
So that means that on the 5th and the 6th of December,
Yes.
You were employed as a doctor with the prison services.
Yes, sir.
And on the 5th and 6th of December, there was an incident at the prison.
Yes.
And am I right in saying that on the 5th, when the incident started to happen, you were still at the prison?
No, I wasn't.
You
actually.
were not?
I was not.
So at what point in time were you called to the prison?
So actually what happened was that I was home. I was home. I'd closed and I was home. Then I'm not sure who alerted me, but I heard that there was an incident. There was an incident going on. So I actually called the prison to find out what's going on. So then I requested, do I need to be there? So then they asked me to come. I mean, it's right to be there.
So at what time did you arrive at the prison?
I sincerely didn't check, so I wouldn't know exactly what time.
Approximately?
I would say around 5-ish.
Okay.
Yeah.
So when you arrived at the prison, what did you observe?
So when I got to the prison, the ambulance, 2 ambulances were there already with the paramedics, the porter, the driver. They were parked. That's where they wash the cars. So I basically joined them, and then I was there with the paramedics, the ambulance, just to find out what is going on and whether they've received anyone. So I was there for some time. Then I was approached. Later on, I think I was joined by Deputy Sam, and then so I asked him.
Say the name again.
Deputy Sam.
Deputy Sam.
Yeah,
Dode.
Deputy there. Yeah, Deputy Sam Dode. And then I think that also CI Alexis Adrian must have come around. So I just basically find out what was going on.
CI who?
Alexis Adrian.
Alexis?
Yeah, Adrian.
Okay.
CI Adrian. So I mean, I was just curious to know what was going on. So they just briefed me that there's some form of riot going on. So that was basically it until the first hostage, CI Radigan, was released.
Okay.
So when he
was released, he was brought to the
ambulance.
To the ambulance.
So I attended to him. We checked his blood pressure, which was to the roofs. We kept him in the ambulance, gave some oxygen as per protocol.
Okay.
Yeah.
So apart from the blood pressure, which was high, were there any other injuries on him?
Personally, I didn't observe any bodily, apart from the clothing were a bit, I wouldn't say torn, but it looked ruffled, perhaps torn. I'm not sure, but there were no bodily injuries. Yeah.
Okay.
Yeah. So we kept him, but the clinic is it's closer to the mail block where the incident was, so I couldn't access it. We didn't have any emergency drugs to bring down the blood pressure in the ambulance then.
But did you have that at the clinic?
Of course we did.
Okay.
We did. But I couldn't access it, so because it was close to where the incident was going on. With that kind of blood pressure, it's better. So I called my colleague in Answalo that we have an incident. I'm sending CI already gone down. The BPs are quite high. So then the first ambulance took him to Answalo Health Center. So so that was the first incident, and So we're there. The night progressed, and then.
1 minute. Tell me something. You said that when you arrived,
Yes.
there were ambulances, two ambulances,
Yes.
that were there at the prison.
Yes.
Did you notice any officers apart from the prison officers? Did you notice any officers from outside that was on site?
So whilst we were there, then that's when we saw the. I would assume they are police and military. They were in black and other uniforms. They came to the scene. So then they proceeded to where the action was. We just kept.
They proceeded to where?
To, I would assume, towards the mail block.
Okay.
Yeah, but we're close to. I kept my position where the ambulance was. I really didn't go down. I didn't see. Ideally, in a riot setting or mass casualty setting, there must be a designated area, and that the medical staff are supposed to be. And we can only.
And that was not there.
Obviously, there was nothing like that, and we couldn't proceed in until it was declared safe for us to proceed inside. So we just kept our place where the ambulance was. So I mean, a number of, some were in brown, others were in black. A number of people came, but we were just there observing what was going on. Not just observing, of course, ready as and when somebody is brought to be attended to, then we attend to it. So personally, I was just with the two paramedics, the two ambulances, the porters, and just making sure that we are ready. I think during that time, I took time to look at the oxygen in the ambulance, make sure that it's working, face masks, the basic emergency stuff. Basically, everything was set. So that as the night progressed, it was also a rainy day, basically, which I guess I'm not sure whether it helped or it didn't help. But I remember at a point, I was called by the then commissioner to come up. I think there was a meeting going at the office. I was asked to come up.
So you went to that meeting, okay? And
so actually didn't. So I got there, and then I was asked that, am I busy? Can I be in the meeting? I said no. There's a lot going down there, and I'd rather prefer to be down.
Okay, so you didn't stay at that meeting?
No, I didn't.
Okay,
I didn't.
But when you went in there, who were in the room attending the meeting?
I actually just stood by the door, and then I spoke directly to the then commissioner. I mean, she spoke to me. Can you be in this meeting?
But there were other people.
There were other people.
Yeah. 1 minute. And there were other people.
Yes.
Were the police or the military part of those who were at that meeting?
I would assume there were a number of, like I said, whilst we were at the ambulance, a number of different uniformed people came in. Some were in brown, some were in black. I'm not really conversant with the different units in the police. Of course, what I can say certainly, if there is a prison officers. I mean, I've worked with them. I know the uniforms they wear. The other units I wouldn't really know. So yeah, but there were quite a number of people in there.
You said there were prison officers present as well. Can you remember who they were?
That's the thing. I really didn't. It was just. Okay. It's like you've been called, just a brief one. Can you be here? No, I have to be down. So then
you went back to where the ambulance were
stationed.
Precisely. Okay. So at that point, were there other injured that were being brought?
Yeah, so I'm not sure at what exact point in time when the, but if I recollect, the people were brought in one by one. Who was bringing them, I wasn't sure, but at a point they had opened we had to move closer to. I'm not sure which gate it is, but after THF, perhaps, after THF there is this gate that, after THF, before you go to the visitors area, I'm not sure the gate number, but we had to come a bit closer so that we could just receive the casualties.
Okay. And the casualties you're talking about, these were inmates of the prison?
Yeah, inmates.
Okay.
Inmates, yeah. So as the night progressed, things, I mean, I wouldn't, I'm careful to, I wouldn't say it got, it was more, it became more eventful. At a point I remember I was, must have been CI and Esther asked me to come in there. So then I had to now, I think now clearance was given to proceed inside into the mail block where the people had been kept in one cell.
Okay.
Yeah.
Did you proceed to the mail
So
block?
I did.
Okay.
I did.
And when you reached the mail block,
Yes.
What did you observe?
So at that time, that's when I saw a number of casualties. I mean,
Okay.
different casualties basically.
And
Gunshots to the thigh, gunshots to the different kinds of injuries. It's I would it wasn't a pleasant sight, obviously.
it was not pleasant.
No, it wasn't pleasant, and almost all the inmates they were all calling me. I should help them. Everybody needed help, but then of course you have to triage, and then look at who needed help at that time most. I remember I must have attended to, if I'm not mistaken, Carlos Juma. He was almost unconscious. He had a swollen hematoma of the eye. He was badly injured, so. I attended to him first. I told whoever was with me then that they should take him straight to the ambulance. I'm not sure whether it's before or after, but one of them, before or after, even at the ambulance, I'd attended to Shabani. Shabani had come with a gunshot to the leg.
And how would you describe that gunshot? Was it serious?
Of course, it was. Like I said, it's the. I want to choose my words carefully, but I want to choose my words carefully.
You should choose your you should choose your words carefully. If what you want to do is to find a word that
appropriately describes
yes.
what I saw.
Yes.
That's what I mean. An injury, a gunshot injury, is an injury, and where an inmate is shot to the leg. There are delicate blood vessels both to the thigh and then to the leg. So when someone is shot, you see the tissues shredded, almost shredded. The person is bleeding. At a point when they brought in, I remember at a point I was at the ambulance when they brought in. I was actually originally put in Kizamba Shabani, then they brought in Mr. Nesta, who looked more injured. His injuries were a bit more serious. So I had to basically try to take him out and then put Mr. Nesta in there. But looking
when
at
you're talking about Mr. Nesta, you are talking about the an elder man who was an inmate at the
yes,
prison.
an elderly man. One of the few inmates you don't have any issues with. He just comes to the clinic when he has to, comes for his medications and proceeds inside. He's a very...
so the clinic was open at that time?
No. I'm just describing pre-riot, my encounters with Mr. Nesta, basically. That you wouldn't... he's a very quiet man. He just comes to clinic. When he has to come to the clinic, comes to take his treatment and then just proceeds in there. But when I saw him that evening with that kind of injuries and everything, I just had, even though Shabani had a gunshot to his leg and the wounds were quite bad, I remember I had to tell him that we are going to put you in the next one. You would have to wait. Of course, he jumped in. He basically laid down on the floor of the ambulance basically and still went down. When I proceeded in, everybody needed attention. There were varied degrees of injury. It wasn't a pleasant sight. I mean, even if it's
Would you describe some of these injuries as being violent injuries?
I would say a gunshot injury must be a violent injury. Yes. What for me, what got to me was the thankfully I remember one Mr. Francis Williams, he had done the right thing. He had, even though he was shot to the thigh, he had tied the leg. He had to achieve so it doesn't bleed out. So some of them had done the right thing, but somewhere it was bad. It was bad. Like I said, it must be Carlos Juma, right? One of them, hematoma to the eye, and of course, as medical doctors, we've been trained to identify serious injuries and be able to attend to them first.
So anybody who was helping you to make the triage as to?
Unfortunately, at that time, the ambulance kept going and coming, so I was just alone.
But are there nurses at the prison?
That is probably perhaps I'm happy you've asked. I guess I would just honor the current commissioner we have. And even the previous ones, I'm sure that they did their best. But at that time, there was only one nurse, together with myself and one assistant, to manage almost 500 people. They had worked the whole day. Of course, we were all there. All three of us were there. I'll just give you a little background. If you would have me. When I was posted to the prison 2022, there were 2 nurses, 2 assistants, plus myself, which was, it's not optimal, but you can do something with that. Then at a point, one nurse, retired. She had gone on retirement. Then, of course, one assistant also was a foreigner, went back to her country. So for 2 years, we're struggling. It was just skeleton staff. Myself, one nurse, Sergeant Poire, Rosemary, and then one assistant. So for almost 2 years, getting additional staff to replace the ones that had left wasn't easy. There had been meetings upon meetings, but nothing was forthcoming. And I guess I would also, if I'm allowed to, but one thing I will credit and I will honor her, the former commissioner, for her efforts. When she came, she saw the state of the fact that there was only a doctor, one nurse, one assistant, and she pushed for us to get a part-timer who comes to help on weekends with methadone dispensing and everything, and basically basic nursing duties. And she also pushed for us to get one additional nurse, So during her time, we had help. It wasn't just it had been 2 years with skeleton staff, one doctor, one nurse, one assistant. Then someone comes, and now we have 2 nurses, one part-timer, plus myself, which is definitely an improvement. It still wasn't optimal, but it was better than before. You understand? So I go back to the night of the incidents. The nurse and assistant so like I said, for 2 years they've been working. She couldn't go on leave, because if she goes on leave, she can't leave me, myself, and assistant to do everything. It's the nursing duties, there are nursing assistant duties, and there are doctor's duties. So you can't call someone. Even though I got there, I could have called them to join me at the prison. But these guys have been working for 2 years back to back. The prison setting, especially the prison medical setting, is not like any normal setting. It demands a lot. And there are essential services that are rendered to the prisoners. We have the methadone program for those who are drug addicts. And what it means that every morning the nurse has to give almost 100 people methadone. Okay? Then we have, because of the closeness and all the challenges that there are, we have a lot of infectious disease around. So retroviral, HIV, hepatitis B, hepatitis C, and we run a special clinic. What it means is that there are times they have to take blood samples. And these they require special attention, and it's still one doctor, one nurse, one assistant to do all this. Then we have the general clinic. We have the hypertension, diabetes, general clinic. So it's a lot of workload. And like I said, if I'm allowed to say also, I think that the prison should be very grateful to Sergeant Poiré, Rosemary, for the work, because within that 2 years that we had the skeleton staff, and perhaps someone would have just resigned. It's a lot of pressure. Unfortunately, inmates don't understand that there's so much that needs to be done. And they are right. They come, they demand their rights. They sometimes, unfortunately, they swear and say all sort of things. But of course, we are trained to be empathetic as medical professionals and try to do our very best under every circumstance we find ourselves. So, I mean, they had done much. So I didn't call them. It was intentional. I didn't call them because they had closed and the clinic had closed and they had gone home. So
you were working alone?
I was working alone
at that time
with the paramedics, and then which are 2 paramedics, with the porters and an ambulance driver. Of course, in retrospect, if I had to, I would rather call for more ambulances, perhaps. The system we have also I think is a very good system, because where Montagne Posée is, it's not too far from Ansboalo. And Ansboalo had 2 doctors who were on call at that time, and some nurses there. So there were hands there, that plus Ans Royal at that time. So dispatching the patient to these centers with the kind of doctors who were there and the kind of hands that were there, it was helpful, basically. But like I said, in retrospect, I guess if we had more ambulances to send the inmates down faster, perhaps that would have also helped. Of course, more hands it's always helpful.
So you were helping
Yes.
inmates?
So I was there alone, and I was there alone basically. And so when I identify, someone who is critically ill, where I can, like for instance, whilst at the ambulance, I think they brought in Fabio Supramanian. His injuries were quite bad, and he was bleeding out. So I quickly had to set 2 IV infusions on both as per protocol. Of course, give oxygen, and then try to push in as much fluid as possible before we send down. But whilst there, when I identify someone who was critically ill, we try to do what we can. If you have to apply some pressure dressing, we do that. And then I'll tell the officers, I'm not sure whether everything was happening so fast. So I'm not sure which hands were with me, whether it's an officer or whatever, but I'll tell whoever is available to try and take this one to the ambulance, basically, so it can be attended to. Under the circumstance, we just did our best. As medic. Looking back, I wish I could have, of course, if there was a way I could have done more or much better, I definitely will. But we did our best under the circumstance.
So throughout the night of the
trip,
that's what you were doing?
Throughout the night. Okay. From the time that we finally got access to some of them, I had to wheel them myself from the meal block to the ambulance. Some of them were brought to me at the ambulance. I remember, whilst you have brought one inmate and you are at the ambulance, then they will bring another one who is critically ill, and then you have to just try and manage that, and send them down. Yeah. So that's the whole night. That's what we did. Okay. It was rainy as well. Like I said, we did our best. Could we have done better, or could I have done better? Of course, they can always do better. Would I have loved to do better? Definitely, I would. If given much help and support, I definitely would. So I did that we did that till I think that around 4-5 a.m.
Okay.
That's when I took my leave home, just to get some rest, and then I came back at 9 a.m. on the 6th. When I came, the nurses had already come they were already at post, and they were also attending to some people at the clinic.
So now there were
at the
others
prison
coming
clinic.
to the clinic.
Exactly.
The prison clinic.
The prison clinic.
Okay.
So then I joined them there, and then we kept seeing patients the whole day. I will still honor them again because there's a time that they are supposed to close work, but we all went way beyond our closing time to attend to as many as we can. Even on the Sunday, on the Saturday, of course. So then on the 6th, that's when you saw other people that you didn't see in the evening. That's when you saw people who came in with burns basically, and then other injuries. So in summary, that's what we did on the 5th and the 6th. Basically in summary, that's it.
All right. On the 5th, just go back. Do you know one inmate at that time, Stefan Mondo?
Yes. Stefan Mondo. Of course, I've known him. Yes, I've been his doctor. I've treated him basically. Yes. So yeah.
Okay. And on the 5th, at any point in time, did anyone come to you regarding his health status?
Of course, no, I'll be sincere, no one did.
Nobody did?
Nobody did, yeah.
Okay. At any one time, nobody came to you?
This has been a practice which the ideal thing or the right thing to do is that before anyone is put in any special area, whether it's a holding cell, whatever, ideally they should consult the doctor for his medical fitness, whether he's even okay to be in such. But the practice had been, unfortunately, is that usually it's when an inmate or a patient has been sent to a place and the person calls in sick, that's when they call the doctor to go and see the person. Of course, so when I'm not sure whether it's before or after, but I think that I probably saw him when he had already been put in the holding cell. And
you saw him when he was being placed there?
Not when he was being put there,
okay.
But after he had been put there. After he had been put there, to check his blood pressure, make sure he has his treatment, basically, yeah. Like I said, there is the right thing, and then there is what has been the practice. The right thing is that before someone is put in any special place, the doctor should see the patient.
Yeah, you have to examine the patient. Know the medical history.
Precisely.
Okay.
But unfortunately, that has not been the practice. Usually, after they have put whoever they are supposed, after they have done that, that's when you are called to go and see the patient when he calls or something. I don't think that is proper practice.
Okay, but the fact that you say yourself that is not proper practice, I agree with you.
Yeah.
Did at any one time you voice that to the management that such practice should cease?
Sincerely speaking, I did not. Why? Because I guess we've all read the Prison Act. We all know what is expected of everyone. So you expect that people do the right thing. So personally, I did not. I just assume that they know the right thing to do, so they just do the right thing. Yeah.
So you know about the Prison Act as to how.
I know, but what I'm supposed to know.
What you're supposed to do, and what other management needs to do in a case before they put someone in isolation or dry cell, whatever it is. Okay.
Definitely.
After the incident, okay, you went home, you had a rest, and then you came back. At any one time, was there any meeting for debriefing as to what happened that you were present at?
No, that's the thing. I if there was, I'll be sincere. If there was, and I'm sure perhaps there was. I don't think that even if I was invited, our hands were full at that time. at the clinic with all the inmates.
No. After the incident itself,
And, yeah,
after
that's what I'm
everything
saying.
had died down, like did the commissioner and the deputy commissioner, did they ever come to you and say, we have a meeting and we'll have to discuss as to
After the incident,
like the injuries, what happened on that night?
After the incident, for about 2 weeks to a month, it was we were busy as a clinic with the kind of staff we have.
So the injuries were still present on the
So some people
inmates?
needed daily dressing.
Pardon?
Some needed daily dressing,
Okay.
some needed alternate dressing, and then you had to constantly review them. We had to send so many people to the hospital for x-rays because of some part of the body that has been shot. They had some pain and all that. So that's not to justify or to justify anything, but it was busy. We had our hands full basically. So that, to answer the question, I really don't remember attending any debriefing meeting. It doesn't mean that there probably wasn't. I'm sure there must have been, but I wasn't there. Yeah.
Okay.
Yeah.
Do you think it would have been necessary to have at least a meeting with the medical personnel at the prison?
Definitely. So incidents happen so that we learn from them.
Exactly.
So then you need to. I think it's proper practice to do that. So I definitely I agree, 100%.
Okay. And normally at the at the clinic, when someone wants to see a doctor, what is the procedure that the inmate will have to follow?
So for there's been back and forth with this. When I joined, I was posted to prison on the 4th of April 2022. What I saw at that time was that it was a walk-in clinic, basically. So the doctor is there. Anyone who is sick reports to the guard, and then the guard will call the nurse, and then is it okay to send this patient because he wants to see the doctor? But realize that it wasn't really. There were some challenges. So I remember the former commissioner. She pushed that the night before, or even the morning, the guard when they are doing their roll call or whatever it is, they try and take down names of inmates who wishes to see the doctor. So by the time then they will make their names available to the medical staff so that they can remove all the files and everything. We tried that also for a while. There were some challenges. It didn't really work. Then there was the introduction of badges, where if you had to come and see the doctor, they'll give you a badge, a pass at the gates to see the doctor. It's been like that, but we keep going back and forth. Currently, what we are doing is that usually when the clinic opens in the morning, the nurse would call down to get names of those who wishes to see the doctor. Then they'll remove the files. So by the time I get there, most files have been removed. There's always been challenges. It's not really a smooth process, but and it's something that myself and the medical team we've had meetings about. One of the challenges that we have currently, as we speak now, we have, apart from myself as a doctor, we have only one nurse working now and one assistant. so that with this kind of challenge where you have skeleton staff, even after all of this, it makes implementing anything that is meant to help progress, it's difficult. It's quite difficult. I would appeal. I know current commissioner has assured me that about a month ago or a few weeks ago we had a meeting that and he has assured me that he's gonna try and get some more nursing stuff, and so I'm hopeful that it's gonna get better. A new place has been designated as a clinic, a multi-center clinic where the dental and all that is going to be. So the future looks promising and better. Usually things take a while, but I'm hoping that it will get better with time. There's never been, once someone wants to see the doctor, usually or see the medical team, there's no the person gets to see the doctor. There's no one is stopped or prevented from seeing the doctor. Once someone has to see the doctor, it's their right. It's their right to see a doctor.
Right,
So
right.
So it's their right to see the doctor. And where for whatever reason I'm not available, because I'm the only one. Usually on Tuesdays and Thursdays, I come down to Perseverance and then Bois de Rose to attend to the inmates who are there. So where I'm not, like today, and someone is critically sick, they usually would send a person to Ansbalo to see a doctor there. So, and under no circumstance, and of course at night, I'm on call. Like yesterday, around 12, I was attending to a patient. So there's anyone who is sick, it's never denied, and it's their right to see a doctor. So yeah.
I will ask you a question now about something medical. Maybe that does not fall within your training. Do you feel that there are inmates who need psychological or psychiatric help?
Everyone in prison does. Everyone in prison does. I don't know whether I'm allowed to. I did my master's in about 3 years ago about looking at the relationship between incarceration and then mental health. And that's what I focused on. My master's 3 years ago. Currently do my PhD as well. And you realize that the prison environment, it's people need help. Just the environment alone, it's predisposes to a lot of and given this, not to say anything, but it's public knowledge. Given the fact that we have a lot of, not a lot, we have drugs. It's common knowledge that we have drugs in the prison and all that, with all the opioids, the crystal meds, and heroin and all that. It all predisposes to a lot of psychological and psychiatric conditions. So that's where the counselors come in. I'm sure they are doing their best. We also have a doctor who is seconded from the Ministry of Health, a psychiatrist who attends only to prisoners. But of course, there's always room for improvement. I would say that one of the things that prisoners need is the counseling. And where, especially after a major incident like that, a lot of people need that. So yeah, that would be my answer.
Okay. Have you ever visited inside the mill block of the prison?
We go there all the time. Monday I was there to see an inmate who said purported he couldn't walk, he couldn't come to court, so I had to go and see him. So we go in there on medical grounds to go and see inmates all the time.
And how would you describe the general hygiene inside the middle block of the prison?
So this falls to me, I guess. As a doctor, I should do better. I should be visiting the place and going around more often and drawing attention to health risk. More often. And I would accept it. This is where I would, as a doctor, I feel like I've not done very well in that area. It's prison. There are a lot of rats, so lepto and all that. So So as a doctor, I can do better. I can do better by visiting more often, making recommendations to the authorities, appropriate authorities, where necessary. So we'll do better. We'll do better.
Okay, but have you ever brought any
On
failures onto the
we have.
management?
We have. I mean, I have.
Okay.
I have.
And have you seen improvement following any recommendations that you've made to the administration?
Usually, I would say things. I would say things take time, which is another area that I feel like I would honor the current commissioner, acting commissioner. He's an action man. So when you recommend something, he pushes for it. Things are like he's a bit forceful and get things done. In the past, you've made a number of recommendations, and I want to believe that things take time, but usually what you see that not much is done. So yeah, you just let go. Basically.
But the fact that you've been with the prison for about 4 years, and you say things takes time, 4 years to attend to certain issues which are very pressing, that would be too long.
Example is where we know that as that the medical unit of the prison is that important. You've made recommendations, been in meetings, you've tried to even get more staff. It's been 4 years, and we are back to where we started. So I wouldn't say nothing is being done. I want to believe. I want to give people the benefit.
Not enough is being done.
I guess so. I know there is a lot of bureaucracy in the system, and things take time. I want to believe that some of them are just excuses, but then of course some are also real challenges. I personally would want to see a system where, when recommendations are made, it's attended to it promptly and as urgently as it needs to be, and not drag over years. Definitely.
What about the food that is provided by the prison? As a doctor,
yes,
as a medical
definitely.
person,
it falls to my responsibility to look at the food and make recommendations, which we have.
So if you have, it means that it was not at the standard that it should be.
We did make recommendations, but not much was done. I mean, we've visited the kitchen areas. We've done what we need to do, but I mean, and like I said, you want to understand, but then again, I would like to say that I'm coming from a background. That's not to justify anything per se. When I traveled to Ghana 2 years ago, I went to the one of the biggest prisons in Ghana. It has over 3,000 inmates. Yeah, and then they have a established clinic and everything. Yeah, just to get and then looking at the kind of conditions there, that's not to justify anything. Looking at the conditions there and the kind of food and everything, you would want to say that looks like it seems better. It's better here, but that's not to say that's the ultimate. It's definitely not the standard. I believe that whatever level anyone is, you can always. Sorry, sir.
So I think you said you are doing your masters.
Currently,
you
my
finished
PhD,
your masters.
I finished, yeah.
You're doing your PhD. You are a qualified medical doctor, so you would know that when we talk about healthcare rights.
Definitely.
We don't compare what happens in one country the other.
Definitely.
So I recognize that you keep saying, no, that's not to justify it. But unfortunately,
yes,
just by doing that,
definitely,
you are justifying it.
Yes, sir.
So what we do is we compare the legal framework and what is happening in there. So if that's I think what we should
do. I understand, sir.
Yeah.
I understand. So, like I said, it's personally, I believe that even when you seem to be doing well, there's always room for improvement. There's always room for improvement. So,
what about the water quality?
Inmates have always complained. We've seen the water itself. It's not the best. Obviously, it's not the best. General principle.
And any recommendations you've made regarding the water quality?
I'll be truthful. I personally haven't done any.
But you are aware that it is not good?
Definitely.
Okay.
Thank you, Commissioner. So I have some questions. Maybe let's first go back to your daily work in the prison health facility. You normally call it a clinic, right?
Yeah, prison
clinic.
Yes.
Yeah. So just repeat for me to understand, because I want to understand your working conditions there. So in terms of medical personnel, at that time that we are inquiring, which is around December 2024, you had one doctor, who is
myself,
yourself.
Yes.
Right.
And then a nurse and an assistant nurse.
So you had a nurse?
One nurse and one assistant.
An assistant nurse. Yes. What does an assistant nurse do?
Basically helps with ideally in the community. In the community, the assistant nurse basically helps with the doctor in the consulting room, amongst other things. But in the prison, because of the skeleton stuff we have, she does other responsibilities.
And so you have one doctor.
Yes.
One qualified nurse.
Yes.
Okay.
And then an assistant.
And you take care of a prison population of 300 people.
No, almost 500.
500.
Almost 500.
So, if we were outside of prison, we are saying we have one doctor taking care of 500 people, right? But then you also said in the prison there are sort of special medical conditions.
Yeah.
Just walk us through
some
of the major ones.
We have the so we run about three major programs. We have the special clinic, which takes care of the HIV patients, hepatitis B and C. We call it special clinic. And for me, that is one of my main what's the name? Something that is that important to me.
For you?
Yeah, for me personally, because
so you have chronic illnesses and you have trauma.
So we have the special clinic, which like infectious disease basically. Then we have the addiction or addictology that has to do with those who are opioid dependent. So those who are on methadone. So every morning they need to get their methadone.
Okay.
Then we have the mental patient. We have quite a number of patients in the prison who are mentally
wellness issues.
Yeah, who have. I mean, they have mental issues basically. They're on treatment for
different kinds of
They're also in prison as
mental
well.
health issues.
Then of course we have the general ones. We have the hypertension, diabetes, in general.
So you would say one doctor, one nurse. There's a lot of pressure there.
Oh, there is.
Okay. And then I think you also, at some point, mentioned that inmates, when they come, sometimes they get frustrated.
They get.
And
So
then they
what happens?
Sorry, just hold on.
Yes, sir.
Because there's something specific I'm looking for.
Okay.
So they come and they want services, but they are not able to get some of the services,
Yes.
and then they swear.
Yeah. So what happens is that I mean, and I as a doctor, if you put yourself, if I put myself in their shoes,
Okay, so what I would like you to do,
yes, sir,
is to not
put myself in their shoes
for now.
Okay.
So because I want you to talk about how you have experienced this.
Yeah. So what happens is that, let's say somebody has had a trauma or something, you send a patient for an X-ray, and then it takes forever to get his X-ray result. I mean, of course, as a doctor, we are trained to take a history, examine the patient, and then do investigations before you can treat. Okay. Of course, whilst you are waiting for the investigation, you can start some empirical treatment. So I mean, if an inmate's suspected, maybe there was something, and then a trauma to the rib or finger, something, and he has come to see the doctor. You've taken the history, you've examined, you've sent for an X-ray, and it's taking forever to get the X-ray result. I mean, any normal person would get frustrated, and it's not their fault. Like I said, they have rights. They have the rights to that.
I totally I just want you to give us your experience. Don't worry about clarifying.
So when they come like that, usually you would tell them that the result is not in. It's going to be in. Some of them are very patient, but then if it goes beyond a certain period, then
okay. So now, how many doctors do you have under, like now? One?
I am.
How many nurses do you have?
One is on leave, so only one currently is on post.
A normal,
we have two.
Two nurses. Okay.
Because we have one at Pralin as well, at the Youth Offenders Facility in Pralin.
So you still have one doctor,
two nurses,
and two nurses taking care of 500 people.
Yes, sir.
Okay. What about the medical equipment? Do you have sufficient medical equipment to look after?
No, we don't. We don't. On the 4th of April 2022, when I started work, I had a meeting with the then Commissioner, Montagne, and about the equipment. There was not. We didn't have an ECG machine. ECG machine is if somebody has a heart attack, you can easily do an ECG and then Even a pulse oximeter, there wasn't a pulse oximeter. So if somebody came with a pulse oximeter to check the saturation, to check the oxygen level in your blood, in your system.
Okay.
So if somebody had an acute asthma attack, you couldn't know the oxygen, you couldn't know the saturation of the patient. There was almost nothing. And I submitted a list of equipment that were needed. It took 2 years. It took 2 years to get some of them. Up to now, I mean, we had a meeting. Was it last week? There was a management meeting, and the nurse in Pralin was in that meeting, and she made a submission that it's been 3 years. The facility is opened. There were no equipment to work with.
Yeah. So what I would like, maybe the secretary can note that. What I would like you to do is compile a list of basic medical equipment.
Definitely.
That you did not have or that you don't have.
Okay,
and
sir.
then share that with us.
Definitely.
And just with some little explanation
I'll do
on
that.
what that equipment
I'll do
is
that.
for. Okay, so if you, let's say do you also work in other health facilities around the country?
So I do.
That's okay.
But the context is that it's not. I don't attend to civilians. I attend to prisoners.
Okay.
So, for instance, at night there is no nurse at the clinic. So, and as a doctor, you can't attend to a patient alone. So then I have to see the inmates in a clinic where there is a nurse. So then I see the patient in Ansbalo.
So so your practice is only confined to the prison.
I see prisoners basically.
Okay, all right. Then medical supplies, like your.
So we've been quite fortunate. Ministry of Health has really been helping with that. So all the consumables and medicine and everything, once we make the requisition, Ministry of Health supplies.
Okay.
So that has not been a problem.
So the medical supplies are
it's optimal.
You are satisfied.
Optimal.
But the equipment is
so
there's a shortage.
So the supplies the Ministry of Health provides, but the equipment falls under prison to purchase for the clinic.
No, that's absolutely. I just wanted to know at this point where
Definitely.
the problematic areas are. Yeah. Would you say there are any other challenges you experience in your working conditions, apart from being understaffed and lack of certain basic equipment?
So maybe I will start with where I personally believe the prison medical system, according to all the available documents and everything, it shouldn't be any less than what is in the community. I personally believe that.
No, it's just to clarify. It's not your personal view. It's
okay. I mean that's
the
that's
legal
what
expectation. So that's why I was asking you.
I understand.
If you work in outside,
Definitely.
then I would have asked you to compare the two. But because you said you don't work outside,
so I work outside, but I see the inmates outside.
Okay. So then continue.
Precisely. So what I expect is that the same standard of care, if not even better, should be given to the inmates. They shouldn't have lesser standard in the prison than when they are outside. So I'm coming home now. So I would appeal again. We've had this meeting, and assurance has been given. For instance, an inmate can get their X-ray result or their blood result on time if the prison system maybe had access to the HIS, where you can just sit on the computer, see the result, rather than waiting days for someone to go and pick up the result from Victoria.
Okay.
And all
no,
that.
I think you've addressed me.
Made that point.
I see the point you're making.
Yeah.
And
that's not all. But the other thing I would also say, which the current commissioner is addressing, is we have only 2 rooms. We have the nurses station and then the doctor's room. That's all there is for the whole clinic.
Sorry, could you speak up so that I can
So
hear?
what I'm saying is, if you come to Montagne Posée now, and what we call a clinic is just 2 rooms. We have the doctor's room, the consulting room, and then we have the nurses station, where the nurse and they do everything, the dressing, administration of drugs, everything there.
Okay.
It's not right.
So the infrastructure is
infrastructure.
Limited. Okay, I think
which is being addressed by the commissioner.
Is there any other challenge? If there's none, there's none.
I've said what I need to say.
Okay.
Yeah.
How would you describe your relationship with the prison authorities, the management of the prison at that time? I'm asking you this question because you work in the prison.
I do.
You take care of the inmates. So there has to be some kind of a relationship.
I'm not sure what it, but it's of course respectful, cordial.
Okay.
But of course, you know that in the medical we have the confidentiality. We have things that govern the medical profession, and sometimes you feel like the prison guards they feel entitled to know about sickness of inmates, which is which is not right. I mean, otherwise there's a breach of confidentiality.
Okay.
So yes, the commissioner, because he's the commissioner, there are certain things and certain knowledge he must have. But then again, sometimes there's a fine line. Where do you draw the line between confidentiality and breach of confidentiality? So that's where the
I think
friction is.
I get your point. The point is basically that you would have situations where
definitely
sometimes the guards want to know certain information.
Not just they want to
know.
They feel entitled to know.
Okay, so now my question is, do you think because you must have discussed with them when that problem happened, so do you think that they know that in terms of the law they are not supposed to have access to those kind of medical records? Or do you feel that they know the law but they're just not wanting to obey the law?
I think that perhaps the challenge we have is some of them do know, some genuinely don't. Like for instance, when you are seeing an inmate, yes, for security reasons, a guard is supposed to be there, but for confidentiality reasons, the guard is not supposed to be there.
They can.
So then that brings a little.
I think that answers the question. But have you ever participated or observed any sensitization, any training that was done where the prison guards, were being made aware of, these rules around confidentiality?
There's this. We have it's mainly on webinars where I've shared the link. I've participated in a number of webinars. I've even been the one to give the lectures, and I've shared those. I've shared them.
I would like you to be direct in answering the questions.
Yeah.
So I appreciate the story.
Yes. I understand.
I know you want to give us as much information, but there's certain specific information I'm looking for.
Yeah.
So some of these questions I would like you to say yes and then you give me details, or no, and then we move on.
Okay.
So my question was, have you participated or observed any training, any meeting where prison guards were being sensitized to understand the right to confidentiality of medical records for inmates?
Yes.
You have?
Yes.
Okay. How often, or can you just describe the nature of that meeting?
So like I was saying, we have the African Health Network, for prisons, basically, for which I'm part of. And every month there is a webinar that I've personally had to participate in some of them. What I do is that I share the link on sometimes with the senior management, basically, and as to whether it will be attended to, that's another thing. Yeah.
So I think your answer doesn't match then, because your answer was yes, right? But what you have described to me is a scenario where you, as a medical doctor, and I don't think it is your job to train people in that particular part, unless you are authorized to. But you was describing a situation where you have a resource that you think can be helpful.
Yes.
You share it with the prison management, and then you are saying whether the guards actually attended the meeting to get the knowledge or not is something you can't speak of.
Definitely.
So your answer cannot be yes, there was a training.
I retrieve then.
It can't be, right?
I understand.
So there is no training, there is no sensitization that you observed, that you participated in, where the guards were getting this knowledge.
Yeah.
Okay. Do you feel? Do you think you were getting enough support from prison authorities for you to be able to do your work?
It depends on the kind of supports. I mean, I've already
So what areas were you getting support? Let's start with the areas you were getting support.
Like I said, the former commissioner did her best to get us a part-timer plus a full-timer.
Okay.
Yeah. So that's something to be grateful for. At a point, even at the clinic area, there was no security on standby. So then sometimes, I mean, inmates could just misbehave, and she tried to get someone posted there.
Okay.
Of course, it didn't last because of manpower challenges.
Okay, so what are the areas where you didn't get support? Now we know the areas you had support.
So where, like I mentioned, equipment was an issue, space, working space an issue. Yeah.
Okay, so when have you ever experienced a scenario where you made a recommendation for a patient to be treated, and that recommendation was not complied with?
So
yes or no?
The answer is yes.
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 Okay.
Yes.
So before you tell me the story, so why didn't you mention that earlier when I said to you? You remember I asked you a question about the nature of your relationship. Then we narrowed it down to
Yes.
do you have areas where you were getting support and areas where you were not? Then you said yes, there are areas. I said let's start with where you got support. Then we went to areas where you were not getting support. Then you didn't mention this one.
It's I guess it just didn't.
You just forgot.
Just forgot about it. Yeah.
Okay. Okay. Tell me this. The scenario.
So I mean, there are times where you make recommendations about zeroing into the diet, food that a special diet that somebody has maybe gastritis. He's not supposed to eat certain kind of food. He's supposed to eat a certain kind of food. You make recommendations, and it's never
honored.
It's never honored. Yeah.
But I'm worried that that is a very fundamental issue. Yeah. Because it goes to the welfare and care
definitely
of the people that you serve, and you were not. I'm calling it a recommendation, but it's not a recommendation. It's a directive.
It's a directive.
Right? You gave a directive which was not complied with,
That's
and then you forgot to mention that. So that might also create an impression, whether intentionally or unintentionally, that some of these things that you are forgetting are things that you are not supposed to be forgetting, because they are the core of your work. Or maybe you just don't want to say negative things about.
No, I think that
people.
I think I just took something to say the truth, the whole truth. So if it comes to me at the time, I would definitely say it. If it doesn't,
do you have any cases where inmates were supposed to come for what you call routine consultation?
Yeah.
And they were prevented from coming to see you, and have you recorded anything like that? Is the answer yes or no? I just saw you.
No.
Nothing you are aware of.
No, not that.
So in your experience, there was no incident where you.
Not that I would know. Like I said, it's their right to get the. Of course,
we are together. I just want to know whether their right was
you would
respected.
You would hear later that I wanted to see the doctor, but it's. Someone would say that I couldn't access.
But I'm not talking about that. I'm talking of routine. So routine maybe let's unpack that.
Yeah.
For me, routine is where I come to see you as my doctor,
Definitely.
and I have a wound.
Yes.
You dress my wound,
Definitely.
and then you say I have to come back after every 2 days for fresh dressing.
Definitely.
So you are expecting me
I'm expecting you.
after every 2 days, but then I don't come because I'm prevented from coming to see you. So you would know that I was expecting to see patient justice at 2 p.m. It didn't come. Do you know of any such cases?
No, I don't.
Okay.
I don't.
Then that's fine.
And the system we are running is not. This is the ideal.
Okay.
That's the ideal. Ideal is that everyone is given an appointment, come at this time or that time or that time. But that's not. That's not the system that is running.
What is
there.
the system?
The system running there is in the morning. Either the guard calls that these inmates want to see the doctor. Some would never put down their name. So then as the day progresses, you get additional calls that this person wants to see the doctor, but access is given to everyone who needs to see the doctor.
So just for me to understand properly, was there something specific
Yes.
I want to know? So are you saying you don't have on your end as the medical clinic,
Yes.
you don't have a system that records, that has like appointments
No, we don't.
for
We don't.
patients who are on routine
We don't.
medical care?
We don't. We
so
don't.
you if I come with, let's go back to my sorry.
Yes.
Let's go back to my example of the wound.
Yes.
So if I come to you with my wound, you look at it, you dress it, and then you say come back after 2 days. You don't record anywhere to say I am expecting to see patient justice at 2 o'clock on Friday.
So it's recorded in the. See, that's the thing. Maybe we are talking about two different things. Wound dressing classically falls in the care of the nurse. The nurse does wound dressing. It's the nurses who do the wound dressing and stuff like that.
Okay.
Of course, when they do the dressing, they would tell you come back. So we have alternate day dressing. We have daily dressing. Those ones are patients are on. They honor their dressing. They are given their appointment. Ideally, we are supposed to. What happens in the community after a dressing, they are given a card. Come back this day. Come at this time. But the system in prison is we don't have that.
Okay, so let's now talk about you, because that
as
one
a
is
doctor,
for the nurse.
that's
for
for the
you.
nurse. As a doctor, when I see a patient and I need to review in 2 days' time, of course I write in the file. I want to see you on Wednesday. If I see you on Monday, I want to see you on Wednesday. Yeah. But I don't. There is nothing like giving an appointment card. No,
So, but you record somewhere
it's
that you are
recorded in
expecting
the-
to
of
see
course.
this patient for
it's
review.
Definitely, it's recorded in the.
So is your evidence that you've never recorded a case where a patient did not turn up for their review?
There are patients who would not turn up, obviously.
So what do you do when a patient doesn't turn up?
We actually call that we are expecting this patient, and sometimes you call several times. That call the guard room, send this patient. I want to see this patient. Sometimes they will tell you that they've called the patient. Patient has refused to come or doesn't want to come.
Okay.
You know,
So I want to make sure we are not talking of hypothetical situations.
Okay.
Did this actually happen? You know, where the patient didn't turn up.
Yes.
You called the prison service.
Yeah.
And they said the patient does not want to come.
So there are instances
Okay.
like that.
So what do you do when that happens? What did you do when that happened? Is that the end of the story for you?
You record it in the notes that so and so has been called at this time for a review, but has refused to come. You know.
How often did that happen?
It's not something that happens all the time. Occasionally.
But it happens.
It happens occasionally.
So, of course, there are similarities between you taking care of us who are outside of prison,
Definitely.
medical-wise. So if I don't show up at your practice, maybe there's no need for you to follow up. But these ones that are in prison, they have limited liberty because that is part of their sentence.
Definitely.
Do you not think that when that kind of when that kind of a problem happens, you also need to check with because you know where the patient is.
Yeah, we do.
The patient is just down the road.
Yes, we do. I mean,
And I'm saying that because in terms of the law, you have the power to do so. So outside prison, you don't have the power to come to my house and say, I'm looking for this patient who didn't turn up. But in the prison, you have the power to. You are one of the most powerful people actually in prison because you can walk in. So why didn't you do that?
I guess number one would be sometimes you have so much work.
Okay.
Then you don't go chasing. But then again, yes, I also, if I'm not mistaken, there is the principle of autonomy, meaning that someone can even decide not to. Okay, I don't want to see the doctor. I don't want to take the treatment.
But when you follow up, you
counsel,
are not. When you follow up
yes.
with, because we are also trying to fix certain issues.
Definitely.
Right? So when you follow up with an inmate, you are not following up to force them to come for review.
Okay.
You're following up to just check if it is actually true that the inmate has decided that they don't want to come for review. Because it could be true that they have been prevented. Well, we have received testimonies from a lot of inmates who say they were scheduled for routine medical care at both the nurse level and the doctor's level, and they were prevented from coming to see you. Right. So that's why we are saying,
understand.
Perhaps under those circumstances,
I should follow up.
Definitely. And you are not in any way undermining their autonomy.
Definitely.
Because you are not forcing them
Definitely.
to come. But we also acknowledge what you said, that you have one doctor,
Definitely.
500
Definitely.
patients. So that creates also a work environment that is stressful. Then you see the Prisons Act and the prisons regulations, speak elaborately about the role of a medical officer. Who is you?
Yeah.
I was just checking here. There are 31 references to medical officer in the prisons regulations. So that shows the amount of responsibility that you have, but also authority that you have. And that's why I asked you earlier that were you getting enough support to enable you to exercise your authority or not? But you said you were. So that's why I'm now taking this direction in my questions. So one of the responsibilities, and you discussed that earlier when you were answering questions, is to inspect the prison.
Definitely.
And I acknowledge that you said, no, this is an area to do better.
Definitely.
And I took it that you were saying you were not inspecting more often. Right. My question is, did you have at that time a schedule for inspecting the prison?
No, there wasn't. And there still isn't, basically.
Okay, so you don't have a schedule?
No, there isn't.
And at that time you did not have a schedule? No. Do you think you should have a schedule?
Definitely.
Okay.
Definitely.
And I will still ask you this question, even though you said no.
Okay.
So you don't have a schedule, but the few times, or the, I don't know, because you didn't say few, you didn't say many, you just said not often, right? So the times that you inspected the prison, did you have a written criteria for inspection?
I would say no. So we basically inspect, write a report, submit it.
Yeah, but I understand. But when you write a report on anything, you must have a criteria. So you can't just walk into a place and inspect without a criteria. So there must be a criteria that you discuss with the prison authorities and say, these are the minimum standards, based again on the law. These are the standards that are the hygiene, the food, the water standards that are expected to be met in prison. So when I walk into the prison, I'm going to inspect the reality to see if it matches these standards. So that the whole inspection is objective, it's scientific, because you are a scientific person.
Definitely.
Right. So if you're just going to walk in and look around and then write a report, that doesn't sound like a scientific process, right? Did any of the authorities ask you for that criteria for inspection?
No one did.
Anyone asked you for inspection schedule?
No one did.
On the day of on 5 and 6 December, so when you arrived, I recall you said around 5 p.m. Remind me, at that time, did you meet with the Commissioner of Prisons?
No, I didn't.
Who did you meet with?
I actually didn't meet with anyone. I just went to the ambulance. Then later, that's when the deputy...
there were ambulances already when you arrived?
Them, yeah.
So when there's an ambulance, generally it means that there's some medical emergency.
Okay, so...
Or you suspect that there's a medical emergency.
Definitely.
Right. And the doctor arrived on the scene and nobody spoke to the doctor.
Yeah, see, I wouldn't say that. I would say I got to the scene. I would say no one officially.
Okay.
That would be the word, officially, because eventually the deputy came. But
that's what we are looking for, Dr. Mills. We are looking for official things. Yeah. So the question is, did anyone?
No.
Yeah. And maybe I'm asking this question because when there's an emergency, and some of the people who have come here, they've said there was a riot, right? So if we take it that there was a riot, I am assuming that this is a serious situation.
Definitely.
And there's already an ambulance. So which means everyone has seen that this situation is serious. It could result in medical emergencies, or it has already resulted in medical emergencies. So wouldn't that mean there is need for coordination between the medical team and the prison authorities?
I agree.
Yeah, so when you walked on the scene and there was no engagement, so you just started doing your work to take care of.
Perhaps, yeah.
Did you make any effort to try and get a briefing?
Like I said, when I got there, from beginning, I rather called that I've heard that there is something going on.
Yes.
Is it okay if I come? So that...
No, I get that.
And when I got the and I saw the ambulance, I had to talk with them, find out, have they seen any patients yet? Have they received anyone?
Okay. Yeah. So your primary concern was on the patients?
Patient care, basically.
Okay. No, I understand what you mean. So which means because from 5 p.m. on 5 December to 4 a.m. on 6 December. One doctor, so many casualties.
2 paramedics.
2 paramedics.
2 ambulances with porters.
Yeah. Was there, or did you make any? I understand that you are trying to deal with casualties, but did you, at some point, find an opportunity to request for medical reinforcements? Or you were stuck in trying to help?
No, I wasn't stuck in. When I arrived initially, I mean, apart from attending to CI Radagon, it was quiet for some time.
Okay.
So there was I didn't see the need. So when I entered, the time I entered the mail block, that's when I saw the extent of the injuries, and that's when I realized that there's so much that needed to be done at that time. That time, the night had already gone, and the ambulances were. What I would say, I would dare say, that even because some ambulances had to leave from prison to Ansbualo and then to Seychelles Hospital. So it wasn't just the 2 ambulances that we're dealing with. More were sent.
But one doctor and 2...
My role that night wasn't to... because I didn't even have access to the clinic. I didn't have access to any medications or anything like that. It was just to triage, stabilize where I can, and send them to the nearest clinics.
Yeah, maybe let me clarify this so
Yes.
that maybe you the way you answer.
Yes.
I'm not necessarily saying it's your duty
Yes.
to call for reinforcements.
Yeah.
The prison has people managing the situation. So perhaps those are the people who have the duty to call reinforcements. In fact, we have taken so many testimonies here, and consistently we've been told that there were reinforcements coming into prison, except that there were security reinforcements, soldiers, police, but nobody told us that there were reinforcements of medical workers. So I'm not saying it's your duty to do that, but I just want to understand if, from your point of view, if first there was any need for reinforcements, which I think we've established there was, but also from your point of view, whether there were any efforts to call for reinforcement, even if it is at night. I'm sure you can still call for it.
What I know for certain is that reinforcements had been sent to the nearest clinics. You know, from Posée to Ansbualo Clinic and Ans Royal, it's not, the distance is not that much, it's not that far. And at a point I got a call that I shouldn't even send any more patients to Ansbualo. I should direct. There was a point that I got that call that I should direct almost from that point all the patients to Ans Royal. Of course, what that meant that they had prepared enough, they had called enough staff. See, that's the thing. There was not. I'm sorry, I have to repeat myself. There was not much. If the clinic was, say, at Gate 1 or close to Gate 1, in a place where the riots was not happening, I could have easily called for more hands, more colleagues, more nurses to come so that we do our best. Like if you had 3 beds or whatever, we could have done much there. Where the current, where the tent is now, which is supposed to be turned into a medical facility, God forbid, but if anything like that happens, it's big enough, we don't have enough beds, we can do much there before, as for primary care, before they are sent to.
Okay, I think I just wanted to know whether there were reinforcements, whether anyone made efforts to bring in reinforcements. I think the answer is no.
No.
Right. Then you also, we heard from other testimonies, but I think you also indicated or touched on that as well. There was blood and water in the prison on the night. Ugly sight of blood and water. So which means inmates were coming into contact with other people's blood. What from a medical point of view, what kind of, does that create any threat?
Of course it does. It does.
What kind of threat?
We've already established the fact that it's prison, the incidence of infectious disease is quite high. And so when there is a mass casualty like that, and people get in contact with blood, transmission is definitely high under such circumstances. That is why we have
transmission of what?
Infectious diseases,
Okay.
HIV, and it's all the others basically. So in the prison we have in stock the
Maybe educate us. HIV. What are these?
hepatitis
others,
B,
yeah?
hepatitis C,
Okay.
basically. So we have the post-exposure prophylaxis in the stock in the clinic, which in the event where people are exposed, we make it available, for them to take basically.
Okay, I think you've answered my question.
Yeah.
That when there is a pool of blood, water,
Yes.
and we took tests. We had from various testimonies that some inmates were made to lie on the floor in that pool of blood and water. Are you aware of that?
No, I
You
wouldn't.
obviously
I wouldn't,
didn't see
yeah.
that. But we have testimony from both the guards and the inmates, which corroborate that happened. And you are confirming that if that happens, that creates a risk of contracting other diseases,
Yeah.
right? Then are you aware that there was an instruction for inmates to clean the prison?
Not to the best of my knowledge. I mean, I'm not. I don't know of that. I don't know of that.
Okay. So you don't know that. But if that happened, would that create any health risks for them?
I'm expecting whoever gives that instruction to also give the necessary tools.
Okay, like what?
In gloves, make sure they wear the recommended protective stuff so that they don't get in contact. Yeah.
Is it acceptable for a human being to clean another human being's blood? I'm asking a medical doctor to just advise.
I'm not. So in the clinic, we have spill of blood all the time.
Okay.
We have cleaners who clean that. There are things they used to clean. So
Are
that
they, when you say cleaners, what do you mean?
we have back in the clinic. I mean, in the clinic, we have people that's their job.
Okay.
Is to clean if there's a spill of blood or anything like that. So they clean in the morning, they clean in the afternoon, they clean at the end of the day. So
are they just cleaners, or these are
they are cleaners,
medical?
yes. No, they are cleaners. I mean, they are not medical people. That's their
I'm not
job.
asking if they are nurses or
No, they are
doctors.
not. Yes, they are cleaners.
They have not been trained. You just go and take people from, say, clean.
I'm not sure of their. Not to the best of my knowledge. Not to the best of my knowledge.
No,
Yeah.
Speak
So-
to the best of you, because you are the doctor, so you
Yes.
guide us here.
Yes, definitely. So
to understand the
understand.
proper health protocols. I guess the point I'm trying to get you to help us
Yes.
is to understand what is the correct health protocol when it comes to cleaning things like human blood and other stuff that may come out of a human body. That can you just ask any person and say, as long as you have gloves, you are fine. Or those medical, those workers that you are talking about, go through some kind of a training on how to handle blood, how to handle different.
I personally, I want to believe that anyone who works in the health setting would have some basic knowledge about.
I thought so too, Doctor.
Yeah, so like I said, I really can't say for certain.
Yeah. So asking. So let's go back to
for
my
me,
question.
what is most important? Even if you get someone just off the road and ask the person to clean, it's really the issue is not about the cleaning. What is important is that if I'm the one cleaning, if it's you who is cleaning, whoever is cleaning, the person is protected enough so that doesn't get in direct contact with fluids, basically, whether it's blood, it's human fluid, basically, because it's the direct contact that's what's going to get a person sick. So once the person is adequately protected, of course, knowledge, you can't throw away knowledge. The fact that you have to guide a person, do this, don't do that, don't do that.
And then maybe finally on that point, ethically.
Ethically, it's not right.
It's
not right. Ethically,
yeah, but
right.
ethically on another point.
Yeah.
I thought so too, but we're moving to the next point.
Okay.
Ethically, is it right to beat up people, assuming that is correct? Assuming that happened. Is it correct? Is it ethically correct to beat up people? They bleed. Sorry.
Yeah.
You beat up people, they bleed, there's a pool of blood, and then you ask them to clean that blood. Doesn't that traumatize?
No, ethically, it's not. It's not ethical to beat anyone. Our profession is do no harm. We don't do any harm. So, can I give a personal opinion? I believe in dialogue. I believe we talk. I believe there is nothing that we can't talk about. I believe that no matter what it is, we can always sit and talk. Yeah. So I believe in talking. That's personal. That's my personal philosophy. So, myself and my nurses, we have challenges, but we always sit and talk, and then we
discuss.
move on.
Yeah.
Yeah,
The bends that you saw, because you mentioned that you saw some
Yeah.
patients, some inmates
Yes.
with bends,
Yeah.
which means these are wounds that are resulting from some kind of burning.
Yes.
Burning from what?
Water.
From water.
Okay. So we have different degrees of burn. We have the first to 4th degree. Others will put it superficial, and different degrees of burn. But most of the ones we saw were superficial, and some were at the back, some were on the thighs. So there were burns. As to, maybe I was quick to say it's water, but of course, looking at the nature of the burn, that's the most, and from what we heard, that's the most likely source of the burn.
Yeah, because I was going to ask you that question.
Yeah.
Why do you call it?
Yeah.
Why do you attribute them to water? It's because you looked at them.
We looked at them, yes.
And you,
also,
based on your experience as a medical doctor, you were satisfied that this is likely as a result of water. Okay. Now, thank you very much, Dr. Mills, for answering my questions. Over to you, Commissioner.
Doctor, good morning.
Good morning, sir.
How are you? Okay, I've got one or two questions that I'm going to navigate around what my colleagues have spoken about, yeah?
Okay, sir.
Okay. You said in the prison setting, when you arrived up to now, you've been always very busy, taking into account that you are only 3 people working.
That's it.
Did you, when you arrived at the prison, were you given the existing SOPs that were there in order to help you with,
No, there was no SOPs.
There was no SOPs?
There was nothing like
Okay.
that. Now we have, yes.
Okay. So, do you think that with the SOPs that you have now, it is helping you to carry out your job better?
Certainly.
Yeah?
Certainly.
Are you the person who is writing the SOPs, or do you receive them?
I had to write the most, if not all the current SOPs for the medical unit.
Okay. Now, you said that there are certain issues that, with drugs and other stuff that is going on inside the prison, and it is sort of a challenge for you and your team in order to solve the problems, yeah? Do you have frequent meetings with the welfare staff and the other people that looks after the welfare of all the disorders that you said?
We have quite often meetings with ABDA, Department of that helps us with the methadone program. We've gone through, of course, we've had meetings, almost the entire staff. We've had meetings with at CDC, where we went through training, guidance. Internally at the prison, not that much meetings between the medical staff and then the welfare department. It's been suggested, we've suggested it, but we've not really had. Howbeit, myself and Ms. Elsa, we've interacted quite. Actually, we even have next week. I intend going to Pralin to with the youth offenders facility to spend quite some time with not just medical, but both medical and the psychosocial bit, and to help. So
are you saying that it is now that you are starting to have proper meetings with the people? Would that say that before this incident happened, you were not having meetings
not really, frequently?
Really.
Now we are having, yeah.
So, okay. Right, now, one thing that I would like to just put to you, maybe you said you've been at the prison settings around and you've seen how it works. The reason why the prison has a team of people which falls under the custodial umbrella is so that they keep prisoners safe inside the prison and administer whatever orders that comes from the authorities.
Yes.
Okay. Now, you talked about the method that you were using to tell an inmate that he should report back to the clinic for dressing and whatever it is, and sometimes it wouldn't happen.
Yes.
Right. Now, the reason I think it wouldn't happen, and I don't know if you would want to agree with me, is that if a medical slip was written and given to the inmate, or not give to the inmate, at the end of your clinical times, you take those papers, medical slips, and give it to the custodial people in the guard room. They would be the people responsible to make sure that at certain times, that as you as prescribed, they come to you.
Okay.
Do you think it would have worked better?
I believe it can, definitely.
Okay. So, are you now sort of doing those? Okay. Now, when I look at the responsibilities that that you have at the prison, one of them states that notification of death, illness, transfers, etc., falls under your preview. Okay? Now, it says that there are A 1, 2, 3, 4, 5, 6 until 8. It says that the medical officer shall record the following: particulars of the deceased after complaint and blah, blah, blah. I suppose you did this. Or you must have got reports from your fellow doctors to guide you with the thing, with what happened. Yes? Now, on having got this document, did you approach the prison authorities to discuss and to debrief on what really happened on the day at the prison?
Yeah. So first, most I would take responsibility. I did not receive any post-mortem report of the death, and I didn't receive from any colleague or anything like that. Of course, what I got back were the discharge summaries of all the inmates that we sent to the hospitals and everything. But for the death, up to now I've not received any.
Yeah, it's okay. You did not receive. That's all right. But you had so many people that you saw.
Definitely.
That you treated.
Definitely.
Did you have a meeting with the commissioner of prisons to show her what happened, and in order for she's got to write a preliminary report as well to send to the minister.
Definitely.
So did you get the chance to talk to her?
There was no meeting like that.
So you didn't get the chance?
No, there was no meeting like that.
Did she call you?
See, like I said, at that time I knew there were a series of meetings happening. I would dare say I was almost every meeting, between senior management meeting, I'm invited, but it's not all of them I'm able to honor because of the nature of the work, because there's so much to be done. There were meetings where I'll be there for an hour, and then I'll be excused so that I can go and attend to emergencies or urgent cases. So at that time there were a number of meetings happening, which I would also say I must have known, but I couldn't attend those meetings. I couldn't attend. What I should have done then was to have called for a one-on-one meeting and then discussed, but I never got the chance to do that. Yeah.
Okay, so you said you never got a chance, but if the superintendent calls you or the commissioner calls you,
then I have to go.
You have to go.
Definitely.
But you did not get any call
to
come and discuss over what happened?
I didn't. I didn't.
Did you, doctor, certify the death of Jerry Machut?
I did.
So you did certify before his body was taken away?
Yeah. Yes, I did.
So you did it in the hospital?
No.
I mean in the prison?
In the prison, yes.
Where he was?
Yes.
Okay. So you did do this. As a doctor, probably, you know the thing that follows a death. Did you advise the people that the forensic people should come up there, cordon the area in order to do a proper investigation?
I did not advise.
You did not?
No, I did not.
I don't know if it was your responsibility, but maybe you could advise. So you didn't?
No, I didn't.
Okay. Now, there are certain things that you talked about. You said you gave information about special diets for inmates that were sick. They couldn't eat solid foods. And you talked about your food inspections.
Yeah.
You talked about the inspections inside the prison. And you said that you did not get good feedback or support from what you said, and things were not happening. Did you request a meeting with the commissioner to ask her, look, I'm the doctor. I've been seconded to you at the prison by the government authorities. Now, why are you not listening to my advice?
No, I didn't. I didn't.
So you didn't?
I didn't.
Do you think that the failure to address those medical and basic admin recommendations by the authority is one amongst the reasons that was creating a stress inside the prison setting?
See, even now, even as we speak now, there are all that we've spoken about. It's still there are inmates who are still complaining that even though I've written or given a directive for them to get this kind of food, they are still not getting it.
Okay, but that's my question.
Yeah.
My question is, do you think it was one of the reasons why there was so much discontent and stress inside the setting?
I mean, it could have contributed. I mean, could have contributed. Could have contributed. Yeah.
You see, the way you have answered this question,
Yes.
it just reminds me of, our earlier exchange.
Yeah.
When I asked you,
Yes.
do you feel that you were supported to do your work? And you said yes and no, right?
Yes.
You see, this you've just mentioned another example here where you gave a medical directive and it was not followed. So do you feel like, are you free to talk?
I would say this. I would say this. Leadership is everything. Everything for me. I believe everything boils down to leadership. I mean, who is leading? I've had better support with the current acting commissioner. He's given us better support than in the past. If I have so much responsibilities with rights and powers, but you write reports, you give directives, and someone is not supported, then it becomes.
I can't help it, but I can see that you are struggling to speak what you want to speak. So, is there some information that you might want to talk to us privately? You have that option.
We can always talk after. Yeah, we can always talk after. Definitely.
Okay. Now I would want to address one issue about incarceration of inmates. Yeah. Have you ever been called to check on an inmate? Give your medical views and test him on an inmate that was being locked inside what they call the isolation cell or the holding cell and whatever. Have you ever been called to do this?
Definitely.
You have?
Yes, please.
Okay. So you've given your views?
Definitely.
And were your views accepted?
Before I say yes or no, I would also say that I understand that it's a prison setting, and prison setting, there's always a fine balance between security reasons and risk, as compared to as opposed to the medical bit. So there's always this fine balance.
Okay. So let's go to the fine balance. Yeah.
Yes.
Right. You don't know the security
Yes.
aspect.
Yes.
But you know
Yes.
your aspect of the
Definitely,
medical grounds.
definitely.
Now, I don't think anybody in their clear mind should go against what a medical professional says about the medical condition of somebody. In my opinion.
Yes.
I don't know.
In fact, by law,
Yes. Yes.
they are required to comply with the doctor's instructions. Did you know that?
I mean, theoretically, yes. I mean, in
No, the
theory.
question is, did you know that? Did you know that by law they have to comply with your instructions? It's a yes or no?
Exactly.
You
So,
know.
see, that's the thing. I can't say yes or no. What I can say is that,
But doctor,
Yes.
it's either you.
See.
If you ask me, do I know
Yes.
whether this is left or this is right?
yes,
My answer, I know whether,
yes,
or I don't know. So we're not asking whether the reasons why they implemented or they did not implement your instructions. We're asking you, do you know
yes,
that in terms of the Prisons Act and the prisons regulations, they are supposed to comply with your directives?
yes. I do.
You know.
But I also know that
Sorry,
the
do you-
commission. I do. Yes.
Okay,
I
then
do.
I'm going to hand you over because,
Yes, sir.
because that's what I just wanted to know, whether you know
Yes,
or
sir.
not.
Yes, sir.
Yeah, but now I'm going to ask you a question probably that you might recall.
Yes, sir.
Do you remember the inmate called Stephen Modo?
I do.
Okay. Do you remember a bit of his medical history?
Definitely.
Okay. Was he a blood pressure patient? Was he suffering from high blood pressure?
Am I allowed to? Is it public? Am I allowed to? Am I allowed to share his public? His medical
not.
in public.
Yeah, maybe not, because we don't have that. Yes, no, maybe not. Yeah, but still, yeah, he shouldn't. I think you can jump that question,
Okay.
Commissioner. Yeah.
Okay. But then my question would be, did you at any time, just on the day of the incident, were you called to give your medical opinion
No.
on
No.
the incarceration of Stephen Modo?
No, I wasn't. No.
You wasn't
No, I
called.
wasn't, no.
Okay. Now you said as well that you are preparing certain documents to help you to conduct your responsibilities in a smoother way at the prisons. Have you considered writing checklists for all the different inspections that you that you want to conduct in future? You've got your checklist and you just tick as you go along.
Definitely.
And then you get this checklist and hand it over to the authorities
Definitely.
so that your recommendations can be looked into.
Yes, sir.
Okay.
Yes, sir.
Now, if I go back
Okay, sir.
to a question that Commissioner Justice asked you about the cleanliness of prison. Do you know in the cleanliness business there is something which is called body fluids?
I'm a doctor, so
Yes, you know that there is a... And body fluids, there's a very, very severe sort of sequence and training that people should have in order to clean body fluids, be it on the roadside, be it after an accident, being in whatever, be it in hospital. So you know that this is a major part of the cleaning business to prevent infection to people and whatever.
definitely.
Okay. So on that night, would you say that this was neglected, or on the next day it was totally neglected at the prison?
What I would say is that perhaps when I came back in the morning, I should have taken time to go around. When I got there, I went straight to the clinic because the clinic was full.
What time did you come back, doctor?
Around 9 a.m. I left at around 4 or 5. I came back at 9 a.m.
9 a.m.
Yes,
in the morning of the 6th?
Of the 6th, yes.
Okay, but when you came, people were already cleaning?
When I came, what I saw a lot of, the place was a lot of mess in the area.
Okay.
Did I see people cleaning? I can't really recall.
Yes.
Maybe the cleaning had not started as of yet.
Okay.
What I saw though, that's when I called my boss that there seems to be something still going on, so they should send some ambulance just in case, because I thought I saw some military guys around in that morning when I got back. So then I called my boss that if I say my boss, I mean Dr. Joanno.
You called who?
Dr. Joanno, that there seemed to be some I'm not sure that something is still going on, so
yes.
They should send an ambulance just in case there are any casualties we can. And then he responded. They sent an ambulance down to the Montagne Posée. So what I recall was that I don't recall cleaning at that time. At that morning, I don't remember there was any cleaning going on. That would be my response.
So you did not, if there was nobody cleaning at that time, it means that the cleanliness took later.
Perhaps later.
So you did not advise?
No, I didn't.
On the procedures to clean?
No, I didn't. And that was like on the 6th. That's when we saw the full extent of people who had been injured the day prior, who we didn't see on the night, And our main focus that morning was to attend to as many people as we can, and so that was our main focus, and that's what we tried to do. Yes.
Okay.
Yes.
Ask
Yes,
a
sir.
follow-up question.
Yes, sir.
So let's move away from cleaning protocols.
Yes, sir.
And go back to your duty to inspect.
Yes, sir.
So you knew after the 6th of December,
Yes,
you
sir.
knew
Yes, sir.
that there has been some, bad injuries
Definitely.
here, resulting from beatings,
Definitely.
because the medical reports say so. So even though you didn't see the pool of blood and water when on the 5th or the 6th, but you reasonably suspected that there had been chaos here.
I actually
So-
walked in water when I went to certify the death on the 5th.
Oh, wow.
So
Okay.
I walked
So
in
you
water.
actually saw the blood
I
in,
saw
in the water.
it was dark, so I couldn't have seen blood, but I saw
But
pool
you
of
saw.
water.
Yeah,
Yes.
so let's just
Yeah.
say, even whether you had seen clearly or not, a reasonable medical doctor
Yes.
would have known that this prison section, considering what had happened on 5 and 6, needed to be cleaned, right? So, wait with me a bit, because I'm not asking you about cleaning protocol.
Definitely.
I just want to know whether with that knowledge you went to inspect the hygiene of the prison.
I'll be frank. Let me see. It was one doctor, one nurse, one assistant. I gave about 80 medical reports, and of course not everyone who even came. So we had a lot.
You had a lot of pressure.
It's not to justify, but we had a lot on our hands.
Okay, no.
So I really didn't go around.
So the answer.
Yes.
So
the
answer is you
I did
not
not
do the inspection.
No, I did not do any inspection.
And if you had given me the opportunity to ask you why,
Yes.
then you would say
Yes.
It's because you were under
We
pressure.
had a lot of
right?
pressure.
Yeah, we note your explanation. I asked that question because we have taken evidence in which I want you to comment from a medical point of view. We have taken evidence which says just after the 6th of of December, the prison was smelling. The prison was a difficult place to be in. I mean, forget about the trauma of having been beaten and seeing people being beaten. But the smell of blood and water and these other detergents. And human beings were living in that place days after.
It's
First, is it possible that
it's possible
that it could have
it's
been
possible,
smelling
very possible.
and it's possible?
It's possible.
Right? Okay, I've taken note of your answer earlier that you didn't do it because you were under pressure from medical emergencies. But I just wanted you to confirm whether
it's very possible.
A witness comes here and says they were living in a place that was smelling with blood for days and weeks after. Would that be consistent with what you saw when you entered the prison? But that's fine. You've said yes. Back to you, Commissioner.
Okay. Doctor, I think I've got 2 or 3 questions. That's it. Would you confirm with us that after the incident, were you ever called for any post-mortem exercise to discuss on what happened and the way forward?
No, I wasn't.
Sorry?
I wasn't.
You was never?
No. Not that I remember.
Okay. Was there, after the incident, did you receive any written recommendations from the authorities that was issued to you with the thinking of the way forward after this incident of I'm talking between the 5th of December 2024 and until the day the new commissioner arrived? Were you given any written recommendations for you to follow and work on?
No, I wasn't.
So you never received anything?
I didn't.
So it was
anything.
Work as usual.
I guess so.
And it was up to you now to decide what you organize.
Precisely.
Okay. My last question, Doctor. When you first started, or before my last, maybe I did not hear you. How many injuries did you treat? How many people did you treat at the hospital? Or how many injuries altogether were there that was listed after the incident?
I mean, we have about close to 80 people.
Sorry?
Close to 80 people. We have their reports. I would, if I may, I would dare say there were. It could even be more because it's not everyone who probably may have come at that time, and So at least what I'm certain about is the report I gave. I gave up to 80.
About 80 people.
About 80 people.
Okay.
Yeah.
Were you at any time given instructions to go and visit the inmates that were admitted at Victoria Hospital?
No, I wasn't. But that's also totally my responsibility. I mean, they are my patients, so even though they are not. Once they are in the hospital, they are not under my jurisdiction. It's human to still visit. So
yeah, but don't you think the authorities would be more eager to know the condition or the state of the injuries of their patients, of the inmates at the moment that were in hospital, and ordered you to go and have a look and give them a report?
I remember there was once a meeting where I was asked whether I'd been able to visit a number of so and so, but so it came up once. I remember I was asked whether.
Who asked you?
It must have been former commissioner who asked whether I've been able to visit. But like I said, for me, I'm a doctor, and these are my patients, so I don't need someone to tell me to go and see them. It's my responsibility. So whether someone acts or not, that's what doctors do.
So you are trying to tell me that you failed in this duty?
I wouldn't say I failed. I visited. I didn't say I didn't visit. I went to see them. I went to see some of them. Of course, the frequency is different. Okay. If it depends on how often, but I didn't say I didn't see them at all.
But you got reports from Victoria Hospital.
Definitely, I got reports
over the phone and whatever.
Over the phone, everything.
Okay, so you were checking on them.
Definitely, I was.
Now, my last question is: when you first started, you said that as the line manager of Sergeant Poiré.
Yes.
You are the line manager of Sergeant Poiré, who is a qualified nurse with you.
Yes, she is.
So you commended Sergeant Poiré.
Not just her, also the nurse assistant. Currently, she's a Corporal Wilner Laureate.
Okay.
They were the main people with me at that time. I think that we had the help also of the part-timer who came to help, but the two for 2 years.
Okay, so you are commending those two people,
definitely
yeah?
They did well.
Now, what are you suggesting would be your recommendation? What would you want to see happens to Sergeant Poiré and Corporal who?
Wilner.
Okay.
Right.
So what are your suggestions? They are prison officers, aren't they?
They are prison officers. Okay. Now we have.
So are you suggesting anything for them as a doctor?
But of course, it's for 2 years it was just the three of us managing the prison under all the pressures, through the riot as well, and they rose up to their duties. They didn't leave ship. They did their best, and they are still doing their best. So I'm not sure what is there, but whatever recommendations or whatever there is as a nation, as an institution that there is to do, that needs to be given them, there has to be.
So this is a verbal recommendation you are making. Have you written any requests or any written recommendations to the authorities?
I haven't, but I've been in meetings where I've verbally mentioned.
Verbally.
I think let's tread carefully on that one.
I'm sorry, but I didn't know that I was supposed to write. I'll do better. I didn't know I was supposed to write written for them, but
okay, doctor. Thank you very much. That's it.
I think that's fine.
Just an advice on something that you said earlier on. I'm all for patient confidentiality, but you said that the guards want to know the status of the patient's health. I think there is a need. I've seen it. Some patients come to court, and I know of these patients. Some of them have hepatitis, some have AIDS. And the guards, they come in very close contact with these inmates. So I believe there is a need, not telling them exactly what the patient has, because that has to remain confidential, but you have to protect the guards as well. You see, have to give them instructions as to what is the best practice, as to what they should do, whether they should be using gloves and masks.
When I started working at the prison, we had these, which unfortunately has drastically decreased. We used to have these health promotion talks for both inmates and guards, where I've had a number of them where we've talked about HIV, hepatitis, and all that, which is what we need to do more. Which we need to do that more, so that they will know that. Which is another thing. Working in the prison, which is another thing for which I would also, unfortunately, it's just verbal, I guess. But the prison officers work, apart from everything, all the security risk and everything, they are also exposed to a lot of infectious diseases.
Exactly, because I see that.
Yes.
I've known people who have AIDS coming to court, and I'm thinking Like they put handcuffs on
Precisely.
them.
Precisely.
And let's say
Precisely.
there's
So,
blood or
so it
anything
will be
that
my
comes.
recommendation that which I don't know whether I'm allowed to I have the right to do that, but the guards need to be also
They need to protect
they
it.
need to
I've
be
seen that.
protected.
Yeah.
Okay.
Yeah.
Okay, sir. So I definitely agree, but of course I can't. What we can do, we can't disclose
Yeah.
people's, but what we can do is to educate them, which we will.
Exactly, because I've seen
Yes, sir.
some inmates come to court,
Definitely.
and I know the medical, but
Definitely.
I cannot obviously
Obviously.
for
Obviously.
confidentiality. I
Obviously.
see that, I keep it to myself,
Definitely.
and that's it. But I see then the guards go with them.
Definitely.
They have no knowledge
idea.
at all, and they're putting themselves at risk.
Yes, sir. Yes, sir. No, well noted, sir. Well noted.
So would you agree that this is happening because there are no SOPs?
Now we have SOPs. So we'll do better. I'm
not blaming you at that stage. What I'm saying is that, the escort team as well, the security people should have their SOPs.
I think that recently the current commissioner has asked every department to produce that. So I think that now all that is in it's been addressed.
There were no SOPs at the time. Until now.
Until
no
now.
SOPs.
Until now.
I just want a yes or no. No story, please.
I understand.
Do you know any visit that was conducted by the Minister of Health in 2024 to inspect the prison?
No.
Do you know of any visit that was conducted by the Prison Advisory Board in 2024?
I don't know.
Okay.
I don't know.
That's
I don't know.
One thing,
Yes, sir.
you have within the Ministry of Health some public health officers.
Yes, sir.
There's a unit or a department, yeah, and these are people who would go around the island. They would inspect places and see as to the
Definitely.
general state of health. And do they ever visit the prison?
They do. Usually upon request, they do.
They come on request.
Upon request. I'm not sure about the.
But normally, what they
their-
should do is just unannounced.
their
They
routine.
should come to the
Yeah.
whatever place they go
Definitely.
in and say, okay, we're going to have an inspection.
Definitely.
Because, like in the community,
Yes, sir.
when there are reports
Definitely.
of health hazards, they just walk in. They come to the community without
Definitely.
announcing that they are
Definitely.
coming.
Definitely.
Yeah.
Definitely. The practice has been that that's the thing I would have to confirm. This is I can't say for certain, but usually what I've seen is upon request they come around. They come around.
I'm good.
Okay. Thank you very much, Dr. Joseph Mills, for coming forward to give your testimony. You have a right not to be victimized by anyone. Your family should not be victimized by anyone for giving, because you have come to give evidence here. If we need further information, we will ask from you.
Yes, sir.
But I remember that there's a piece that you still want to give us. But if we need any further evidence, we will call on you so that you can help us. I'm going to ask the media to evacuate the room. Then we'll call you back.